Thanks, Bonnie.
Just 1 second, and I'll let you know when you're on.
All right.
Okay, you are on.
All right, let's call the Monday, July 17th meeting of the Community Wellness Committee to order. So I'm here, Councilmember Murphy.
I'm here.
Councilmember Lepard-Shu.
I'm here.
And health officer? Is it health officer? Is that the proper?
City Health Officer.
City Health Officer, Dr. Jorson. All right, so we don't have any minutes to approve, but I'll kind of recap for everyone's purpose kind of what we talked about briefly in our last meeting in June 5th. One, we did further debrief of the Food Insecurity Summit, and we did get out to the participants, a list of all the participants, and I was supposed to get out notes. Frankly, I haven't finished those off. That's been taking a little more time than I expected, so I'll try to get those together and get them out to them. We also talked about next steps regarding food insecurity. That was actually kind of an interesting conversation that went several different directions. One of the things that came out of the Food Insecurity Summit was, we're hearing the same themes over and over. Housing, obviously we've heard that, and I think every group that we've talked to. And transportation came up once again, that folks have difficulty with transportation and getting to either stores or getting to some of the food pantries. And so we talked about maybe trying to do a transportation survey and understand a little bit more what the needs were. And then we also talked about kind of a volunteer action. Is there any way that we could create, I think Katie, this was your idea, kind of a volunteer action group around transporting folks to particular places if need be. Example we talked about was some of the kind of elderly folks in our community that can't, might have difficulties getting transported. A few years back, I was stopped at Center Street Deli when it was still open, and there was an older woman there, and it was a Sunday, it was snowing, there was like snow on the ground, lots of snowbanks, and she was dressed very smartly for a Sunday afternoon in the snow. She had a very nice dress and very nice jacket and everything else, and so she was buying some food, and she started to walk out, and I walked out after her, and then I realized she was walking down the street, so I asked her if she wanted a ride, and she got in, and she was really relieved to not have to walk home in the storm. And she lived right over on right near the Asa Allison Armory building there. She was right across the street, or kind of on an angle, and she was talking to me about how it was so difficult once the Great American that used to be in the
PNC.
That's what it was, right? It was in that shopping center there, how it left, and that she has difficulties getting to Southside, and I think she was very intimidated by the bus, and this is not a critique on our buses, and we do a great job, but she was walking to the Center Street Deli, and that was where she was using as her main shopping food source, and I just thought, well, that's really tragic. So I use her as an example of someone we might want to think about for kind of organizing a survey, and then B, maybe thinking about how we might work with some of the food insecurity groups to organize a volunteer kind of action or transportation type of group, especially for elderly folks. We also talked about trying to create kind of a website where folks that would like to get involved in volunteering. That was another issue that came up in the food insecurity, that it seemed like, we've heard this in other places as well. All of our really wonderful nonprofit organizations within the community are just doing everything they can with the personnel that they have, and they're just taxed, and there's just so much need, and obviously money is short in all places, and so they really have a need for volunteers. So I think we thought that it might be interesting to see if we could activate the All For Otsio, All For Oneonta, the mayor's website, to maybe have volunteer announcements of volunteer needs in different organizations, and try to see if we can begin to galvanize more volunteers in general. And then we also talked about having another meeting. We did specify when that we would have, because the food insecurity folks were overwhelmingly positive about having that meeting, even though that they've been meeting in some ways on their own, but we were able to pull together folks that they didn't have represented, and they really wanted to have further conversations. So I think we need to think about that, which is one of the things I've added to our agenda for tonight. We also talked about other issues, and Katie, I'm going to point to you, so fill in the blanks if I don't explain this well.
Sure.
we talked about developing what I'm gonna call a purchasing policy, because we were kind of talking about that we have a green purchasing policy, right? So kind of guidelines for how city staff might think about purchasing with regards to, you know, green products as opposed to other products that might be, you know, less healthy for the environment. And so one of the things we were thinking about was to have kind of a wellness purchasing policy. How, you know, what does that mean? How do we think about that? And maybe to have some guidelines, I guess is really more what it is for us to think about. So I don't know if you want to elaborate a little bit on that.
Yeah, I think just trying to identify like what are the wellness goals for the city and how does that inform us at budget time to take that into consideration to move the city sort of toward those wellness goals.
Well, I mistakenly also left that off the agenda, even though I made a note in this to want to come back to it. So we'll add that to the other business and talk about that, and then maybe give some other time to the transportation issue as well as the volunteer action piece. But I did want to start with our first agenda item, which was, again, the food and security folks talked about wanting to have another meeting and wanted to start thinking about whether or not, you know, when we want to have that, you know, and begin to kind of tease out some thinking about that. So I'll just leave that to everyone's thoughts. Do we want to think about an early fall, you know, October-ish type of, or September-ish date and get that group together? Thinking?
It might be good since such a sadly large number of our folks that are in Oneonta that could be going hungry are students. And it might be a better idea once the schools are in session to see where things are with at least that particular subset of the population. So maybe late September, early October.
I have in my notes from last time following up on food insecurity in September and children's mental health in October. I don't have any reasoning for that. It's just I guess what we talked about last time.
Yeah. I mean, I think it makes sense and it's consistent with Luke's logic there, is that we do think about September goal that allows the students to get back, settle in. I know on our campus we have a little bit of a, I would say renewed, but a little bit more focused effort on trying to support students. And you certainly heard the numbers about food security amongst college students, which is surprisingly high. So I think that might be a good time to, you know, make sure we're involving. We did not have a Hardwick representative at the last meeting, but we can work to get them there. Perhaps a little different circumstances since they all are on campus, but still I can't imagine that they're alone with that. Especially having taught there, I can tell you that it's very similar students. So yeah, let's think about a late September. So I mean, do you want to just kind of figure out a date right now?
Sure, it's coming up quick.
It is coming up quick. Let's see. I think I am good. On Wednesday nights I have meetings in Binghamton until December. So any nights besides Wednesdays would be fun with me.
Well, unfortunately, I have a class Thursdays now, from 4 to 7. So I think, I mean, that's, unless we do it earlier, that was what a lot of folks were asking for the first time.
Mm-hmm. That's right. Like during the workday.
Right.
I think I could do, so I'm doing my student teaching, which should be done by 3. Was 3 to, what time we did it, 4:30 last time,
I
was
think
it?
we did 4 to 5:30 is that what we did it?
That sounds right. Yeah.
Or 4:30 to 6, something right around there. 3 o'clock and try something like that, 3 to 4:30?
Sure.
Does that work? If we're gonna do a Zoom?
Yeah.
Okay, then that should be even easier to, yeah, I think that would be fine.
What's the date that you?
You said Wednesdays are out completely?
Wednesdays are out, yeah. Monday, Tuesday,
Well, if we did it on a Thursday, I could always start and then leave when I gotta go to class, if that was okay with you all to take over from that point on. But I mean, we were floating around the, you know, questions and everything else anyhow.
Right.
If you wanted to do that, if that works better for folks. The other alternative would be to look for a Tuesday,
sure.
prior
I think it's
to.
good you're there.
What's that?
I think it's good that you're there.
I agree.
Okay.
Yeah.
Thanks.
Tuesday.
So you wanna try Tuesday then? What are we looking
Tuesday's
at?
good.
October 3rd? October 3rd might be good. October 10th?
We were thinking late September,
September,
so
I'm sorry.
we try maybe the 25th,
That is
26th, Tuesday,
26th.
26th?
26th.
I might not be able to do
So then, look,
The
what,
19th is fine with me. It's before council meeting, so.
Let's see, that's 2 weeks after the kids get back. You think you'll be settled enough by that point?
you wanna go for an October 3rd date, and then we can just push the other meeting to the
Sure.
late October, would that work?
That works for me.
Yeah, okay.
Okay, so tentatively, we'll say 10/3, so October 3rd, a Tuesday, and it's 3 to 4:30.
Yep.
Okay, and we obviously have the mailing list, so that's pretty easy to be able to shoot that out to everybody. We'll get the Zoom from Carrie once again. She set it up real quickly. Or Bonnie, sorry, Bonnie, we're doing so we did
Okay,
as well.
you're good.
And then we will do that. So, all right, so that sounds good. And I think what we can do is, we can certainly, in our September meeting, kind of, well, we also have August meeting at some point, pass around, get our questions.
Yeah.
And this is interesting because this is our first follow-up
Yep.
meeting, right? So what do those questions look like? Katie, you had some ideas of things you wanted to ask. And I think we all were thinking, hindsight, boy, would have been nice to ask this, but this might be the opportunity to do that. And to follow up on some of the, what developments, catch us up on developments since May.
Mm-hmm.
Okay, so the other piece then was children, teen, and health. We have to get better names, or maybe I just need to remember them. But basically having a second follow-up meeting with the same group around children, teen, kind of health and mental health and wellness. And we talked about having that, as you're saying, end of August, or end of October. What do we want to think for that?
I could do the 24th,
24th looks open to me.
same time frame, 3 to 4:30.
Mm-hmm.
I think I have some new folks that I want to invite to that one too, so, good.
Yeah, I think that'd be good. That's such a broad cutting, sweeping topic, right? It was interesting the different groups that were there, and it was interesting that we were probably missing a lot of different groups that could have been there as well. So, okay, what we can do is just dedicate to the September meeting to planning both of these, and just kind of knock out all the planning and have all of our questions ready to roll.
That sounds good.
Is there any format changes, or you think they were fine as they were?
I think they were good. The only thing that I've noticed in the last couple that I've attended is that we really, because conversation is kind of organic, I feel like we only really get to 3 questions. So I really want to prioritize and drill down to what we want those 3 questions to be.
Yeah.
That's my only observation from a procedural standpoint.
Yep. Yeah, no, we had a lot of questions on the board, and then, right, we only got to a few of them.
And I think it was hard prioritizing the moment,
Yeah,
what we wanted folks to really answer.
yeah. And frankly, I also felt like it was like our first kind of get to know you type of meeting, and so there was just a lot of talking with organizations and just a lot of general talk, which I found to be quite helpful. Personally, as I didn't know much about the institutions that we were working with. All right, good. So anything else with regard to food insecurity planning, and then our children, teen health and wellness planning for those follow-up meetings? Anything else?
No, there's one thing I'm thinking about, but I'm gonna see if I can, with regard to the food insecurity, just bringing in ideas from other communities, maybe, things that are working in other places, maybe trying to make some contacts beforehand. The hesitation that I have obviously is that, obviously, and you mentioned this, a lot of our nonprofits who are doing this work are doing a lot and have, limited capacity of volunteers who are doing the most. And, so I don't know how helpful introducing new ideas would be, but it might be, I don't know, I think, just wondering if there's anything that's working anywhere else that could be implemented here or that we could talk through. So for example, I know that there are places that have community fridges. We don't have one of those. I don't know if anybody would maintain it. I don't know I know that obviously this is not a unique to Oneonta problem, so I would be interested in exploring what other communities are doing in a way. I want to do it in a way that doesn't make the folks who are doing the work feel like they need to be doing more. So that's all. That's why I was going to put my comments.
Well, and so, I appreciate that concern. I think there are other successful models we certainly need to be taking into consideration. I think, maybe our partners are, but to your point, what models can exist? This is very unique, right? We are, elected officials working with nonprofits in the role of A, facilitating, B, advocating for, and 3, trying to connect to grants. So the facilitation role is really important. So it begs the question, are there other examples of ways in which communities are facilitating work around these particular issues? And if so, what does that look like? And I think that fits in with something I want to bring up as a concern, I think really nicely. For me, the concern is, how do we set something up? First of all, what needs to be set up? What structure needs to exist? How do we set that up so that there is structure beyond this council?
Yeah.
Right? Meaning, I appreciate the mayor's focus on these issues. They're important issues. But in 5 or 10 years, if none of us are sitting here in the council and the mayor's not still sitting in the seat, and there's another interest, how do we take these valuable, what we're seeing, really valuable roles, facilitating, how many times do we hear from all the folks, we've never had these conversations before, this is really neat, and we're like, whoa, just getting in the same room, that seems to be so powerful for these organizations. How do we create some kind of structure so that they have those conversations beyond this council, beyond this mayor?
Yeah.
And I think the other thing too, what I hear you saying, it might just necessarily be about what is your community, what is your city doing around these issues. So it's not about what all your nonprofits are not doing, is that what we as a city can continue to do and facilitate around this issue.
Yeah.
Right.
I think that's a great
Yeah.
Yeah.
It's about us learning
Right.
how we can step in and help.
Yeah, because let's call it what it is. This is a new thing for us,
Mhm.
right? I mean,
Yeah.
this mayor's put together this council committee, and this is the first that I know of this particular type of group. And while we're still trying to figure out what our space is here and make it happen, your point, other communities may have already figured this out and are doing this really well.
Yeah.
What does that look like? And then how do we kind of codify that? And that's exactly it. That's my interest. How do we codify it so it exists, whoever's sitting around it?
Yeah. Yeah.
Yeah, maybe that second part of the question is not, we don't need to think about it now or for these next meetings, but if the first part that you're bringing up would be interesting is maybe we want to go into some examples and say, what are your thoughts about this particular niche role that we're seeing that we could play, give us some feedback. Cool.
Let me take some notes so I don't forget them.
Yeah.
If you want me to call other cities, I'm happy to.
Yes.
And I did that back in the
Awesome.
day, like I called Utica or Ithaca, what are you doing with your masks? And, like people were very willing to talk to me and, and share what they were doing, so.
Cool, that would be awesome.
You too?
Yes, please. Yeah.
I'd say maybe we can all try to dig in a little bit, see what we can find, right?
Do a little myself, but yeah, it'd be good if we all kind of share that and come back with some ideas and inspiration. Yeah.
Any other points on that? Oh, I'm sorry, I did not pass this along. The mayor, since this regards, he couldn't be with us today, so he was wanted to be here, but there was, he needed to take some time and he's been pretty strong for a while. Just probably need to have a little downtime, but was quite concerned about letting us know that he supported this committee and appreciates what we're doing. So I wanted to pass that along to everyone. All right, unless there's any other points on A and B, which were kind of interconnected. So, air quality monitoring sensor installation, this came up because a resident emailed me, I think in my capacity as environmental board liaison and the environmental board chair, but immediately I thought to myself, this is not just an environmental board type of thing. I think we spoke about this last Tuesday. I think this fits really neatly in community wellness. Now, we've kind of defined where we want to focus on, but clearly, our conversation, just prior to coming in here about the air quality concerns, I think that, we need to start thinking about this. And it's tragic to have to talk about that unfortunately this might be in some ways somewhat of a normal occurrence if things continue as they are. Hopefully they will not. But the particular constituent mentioned that there were these particular air quality sensors that could be installed that were pretty cheap. So in having conversation on the backside with Greg and with Chris, they were going to kind of look in and see what the costs were, and they had some really good ideas. And it's fun to see kind of Greg get excited about the things that he's really passionate about and does really well in. But he was looking and thinking about how we might be able to tie these in to be able to your point, get data that would then inform, like we might have some kind of local air quality alert on our website that could be monitored by folks, so that and I'm saying that the website, but he was saying how do we pull the data on this in a particular type of way and have that available, which I think is exactly to your point about having it on the website. So I think there's some interesting conversations that were going on. That are starting to go on there, and it seemed like people were pretty interested. They were looking for maybe ways to fund it. Chris wasn't sure that we would be able to fund it through, I forget which way there was some other grant he was talking about, so they were kind of investigating that. So I hope might have some information today, but they are squarely kind of working on it. But, so that's the kind of behind the scenes. Doctor, what was your thinking in terms of?
Yeah, so is the question about the fact that the data we're getting from airnow.gov not accurate for Oneonta? Is that why they want to have our own sensors installed?
So the person who emailed me, and I don't pretend to know anything about this, so I'm going on by what this person said that we have only one station, I think he said it was in Stanford, that is monitoring the air quality. And again, I haven't checked whether that is true or not. But so if that's true, then it might be helpful to have a little bit more kind of immediate information about where our air quality sensors are, so that we have kind of immediate data, being driving our decisions, like the pool decision today, if that's the case.
Yeah, and I think making that information accessible to residents is really important, because, we can see that the air is not good, and we're going to the website, whichever website we go to, to get the information, helping people understand what that means to them, I think, is a benefit of having that data be accessible.
Mm-hmm.
And even if it is data from Stanford, if that's what we're making our call on, I think we need to facilitate reporting that, what the air quality is, and, again, what that means.
Well, and the constituent, though, and I agree with you, I think this is important information, but the constituent said they were only a couple $100 for these air sensor things. Now, Greg kind of upped the stakes and talked about trying to make it a smart thing and be able to make it, can integrate, the data, I guess it has some kind of Wi-Fi connection, whatever. So maybe that increases the cost, but if we're talking about $200, I can't think we're talking about $20,000 for, this other thing. So again, we'll wait till they get some pricing back, but it sounded like this would be something that might be, relatively cheap, for the council certainly to consider if it has to come out of the general fund or wherever it might come out of, but it didn't seem like it was a break the bank type of proposition for these. So my thinking was if we can add more information to our decision making and helping our residents making decisions about what they need to do, then that would be great. Go ahead, Caleb, what do you think?
There's some information on the EPA website about air sensor toolboxes, They also have, some information on grants
Okay.
and loans, I think of the product itself. So that's interesting.
So
I
that,
just pulled this up, so I will look more at that, but,
I think that may have been what the fellow recommended. He sent along a link, and
okay.
I just got this and wasn't able to spend as much time looking at it as I'd like. So thoughts about that? I mean, I guess I'm saying is that, do we want to kind of invest in doing the homework and the legwork, which certainly Greg has already started, he was quite interested in this particular idea, with the idea of A, maybe down the line purchasing these sensors, and then B, think about how we would integrate it into our website, or
Yeah,
Cool.
I agree. I mean, I think, I know thankfully we haven't seen a lot of it, but Chief Knapp did say that already. I mean, this is just the first season, we're only a couple of months into this really, really bad, but he was still saying there was an ambulance that needed to be, right? There was an ambulance for someone with perhaps a comorbidity. But, I mean, if this is a continual thing, I've seen statistics equating this to several cigarettes a day. So it could become larger and larger problem if this continues, God forbid, or even gets worse. I think fits well within the scope of this committee to research this and to push forward with the investment. Like you said, again, I'm not sure how much this, even if it was 10 times the cost for $2,000 out of $200 potentially, but to give folks a better idea of when it's safe to go out, what the different levels mean for a hyper-localized thing. Stanford's not terribly far away, but the way the wind patterns flow, it could be very different than what we're experiencing in Oneonta. Because it's a smaller area that this is affecting, and it could be the difference between super high versus high, and that could really impact folks, especially with pre-existing conditions. Which is a long way of saying yes, we should.
Yeah.
So I think I would defer to Greg, who has an engineering background, as to how accurate this kind of sensor would be in order for us to rely on that for guidance as opposed to airnow.gov. I mean, it geographically may be closer, but what is the actual sensor telling us? Do we want to rely on it to make these decisions and recommendations? I guess, again, I think Greg would understand the science behind it and be able to give us that kind of guidance. In terms of what to do with certain levels, that's very clearly spelled out on airnow.gov, and you could just put a link to that on the website. For example, today at 1:46, it says people with heart or lung disease, older adults, children, and teens should choose less strenuous activity, shorten the amount of time you are active outdoors, which is why probably they closed the pool, be active outdoors. So, I mean, there's very clear guidance. We don't have to make it up.
Yeah.
It's just those numbers, the levels that then it's good, moderate, unhealthy for sensitive groups. That's where we are today. Unhealthy, very unhealthy, and hazardous. That's when we have you guys wear N95s outdoors if you would, or want to. But yeah, there's certain, and have a link to that on the website, I think. For now, just for airnow.gov would be good, but then in the future, if we develop our own measuring device, I think we can still link it to those recommendations.
When you raise a good point, which is if the sensor in Stanford is a federal thing, if we install local sensors that differ from that, are we then taking on any sort of liability
Yeah.
with regard to making recommendations?
Yeah, especially when you're talking about our employees.
Yeah.
Yeah, I mean, when all this first started happening, I was kind of spearheading it, and I was taking information from like Utica, Syracuse, Albany, and kind of making the best judgment. I mean, when you look outside and you can barely see Franklin Mountain, it's not good. So, I mean, we at one point, I had recommended that all the city employees, I think it was a couple of days where it was hazardous,
Right, yeah.
that nobody work outside, and push that off to Greg, and I think that's what they ended up doing, so.
But there are clear recommendations for if you have to be outside to wear N95
Oh, yeah,
masks,
yeah.
because there's
Yep.
clear data that helps. I guess there was some pushback from some of the city employees that didn't want to do that, or didn't feel like, I guess we can't make them do that, but we can at least offer, and limit time outdoors, obviously, yes.
I mean, we've all dealt with masks, but if it's 90 degrees out and you're outside working and trying to wear one of those, you start sweating. As soon as that happens and you're outside working, like the effectiveness of it goes way down, so. For everyone's safety, I thought it was best to probably not to limit everything outside.
Oh, yeah, definitely.
Yeah.
Yes.
So, I mean, from what you're saying, we need to understand how good the sensors we can install here would be, and we certainly need to have them linked, and I think there's ways to be able to link them into these larger systems, but it's, from what you're saying, it almost seems like if we did have kind of real-time monitoring of our air around here, maybe in several different stations, it would aid you and aid Greg in making decisions about things, and in terms of your approach and thinking, is that the case?
I mean, yeah, it'll certainly give us definitive information, but like, I guess I'm just saying, I didn't have that definitive information, so I was going by what everyone around us, like everyone around us is purple, we're in between them, so we're hazardous, so just eyeballing the
Yeah.
situation.
I mean, you can put Oneonta into this app, the airnow.gov, you can put Oneonta and it gives you a number, I don't know where they get that from.
Yeah, maybe they're doing the same thing.
Yeah.
There's also like, if you look at the actual app, there's like the circles, those are like don't quote me on this, but like the federal type sensors, like
Okay.
the more expensive ones, and then there's, I believe, square symbols. Those are like your lower dollar value sensors,
Oh, okay.
so.
Interesting.
And I wanna say they recently put one up Cooperstown area.
Oh, cool.
So it sounds like a good thing to explore for sure.
Yeah. It's just one of those things, like you guys were talking about earlier, though, if a couple years of no smoke and you have to pay for the upgrades on these things and to maintain them, come budget time, is it gonna pass?
Yeah. Does that fit into our wellness purchasing policy?
Right.
Yeah.
Cause I've run into the same thing with like flooding for the Susquehanna River, like having specific sensor. There was a sensor that was tied to the National Weather Service in Binghamton and make forecasts for me. So like, that's useful information. They can tell me when it's gonna crest as far as the river and at what height, and that would help me significantly for like evacuations, but the floods have now, we don't have any flood, or we haven't had floods in a while,
Yep.
and so the funding went away for that, and now it just, so. It's one of those things now, I look at a ruler on the side of the bridge and have no idea what the river is gonna do, so it's like we're reactive instead of being proactive, so. That's just, I wanted to give you that example because it's happened, so. Cause I'm sure there's gonna be a sensor, or the sensor's gonna need to be upgraded or maintained and calibrated, and there will be a cost of that, and so.
Well, another similar thing is we're still measuring COVID in the wastewater, and I don't know, I know I get that report, Mark and Greg do, but first week of July it had bumped back up. It's obviously still there, the most recent data point was lower, but present but not quantifiable, but you know, should we be sharing that on our website for the community to know? I think most people recognize that that's probably more accurate than any of the county level case data, because people just aren't reporting it or may not even be aware that they have it, but may it not inform people when it's time to encourage the new booster vaccine when it comes out in the fall? I don't know. I think it's data that we have. Do we want to share it publicly?
I'll respond on a personal level. I think whether we're talking about our, the wastewater data or air sensor data or river, well, maybe river's a little bit different, but when people can make decisions based on the facts and the data that's in front of them, it helps them make better decisions, right? So if families are concerned about their young children playing outside, and we know in real time that the air quality is high, now you can make an informed decision. So in my thinking, the more information we can get into the hands of the public, the more informed it helps the decision be. Again, maybe the water, right, that's maybe specific just to you all, but maybe there's other examples that we haven't really encountered yet that we're gonna be encountering. So for me, yes, that is absolutely what we need to do. The challenge is how do we do it, right? And how do we get it on the website? Who does that? And how do we
That's the big
get,
question.
yeah, exactly, get that moving very quickly, so it's taking place. I mean, we don't want to be looking at wastewater counts from April, right? That serves nobody any good, so how do we do that? And then the third piece is how do we get people beginning to utilize that site? I feel like communication in Oneonta, maybe it's in general, is really difficult. And I've come to the conclusion, here's my view on this. We have so many different generations that use very different communication things, right? I mean, from folks that don't use smartphones and rely upon simply only the Daily Star or word of mouth with friends, to people that are using apps that, and then what apps are they using? Older folks use Facebook, younger folks are using, who knows what they're using today, but therefore, so it means that it's difficult to communicate effectively with a wide range of constituents. So how do we get the word out to people, and how do we get them beginning to track into the website to be able to get their information?
Yeah, I was just gonna underscore your point, that I think that it's being the resource that people can look at consistently for those types of data. Like, the complaint that was made, it wasn't really a complaint, it was more of a, here's my perspective. On the website, on the Facebook, on the post about the pool was, I wish I had known that before I got my kids dressed to go to the pool, and they got excited to go, and then we couldn't go. And so, to your point, having that available, making that more available, getting it into people's hands, but really becoming like the trusted, like a consistent resource for that kind of information, so that it isn't a guess. How do we kind of take the guess, like they know they can find it, and it's up to date. Because that is a really big challenge. Under my many hats at the city, that's the biggest challenge, is how do we get the message out to people consistently all the time? Yeah.
Yeah, I've gotten away from using Facebook. I don't know about, you use it more than I do, but I would start to look at the engagements and I would put out posts of information. I'd get like 2 engagements.
Yeah.
And I'm like, wow, this is not working. I thought, oh, this is gonna be it. This is gonna be help me be able to communicate with people. So, that's a real challenge.
Yeah. This isn't the committee for it, but I did sit through a presentation with it's an app, and it's a municipality specific app. And to your point, it wouldn't work for everybody, but their resident engagement was like kind of the #1 goal behind the app. So if there's some interest there, and it sounds like, I in the back of my mind, since I sat through that presentation, I've been thinking like, I'm just gonna share this because I feel like we could benefit from it. And it does sound like something that would help, because if you had it on your phone, you could just check.
Right, well, I mean, bottom line is I think we can all agree that we have to communicate in many different ways. And so if there's an app, that's one way. If it's on the website, it's another way. If we're, whatever. So
But
you piqued my curiosity. You said it's not for the committee, but, I think it's related. What does this app do? Is it something that if this is we would need to purchase, like the website behind the scenes for someone to be able to kind of build the app and download it?
Kind of. It's really inexpensive actually, for what it is, I think. The only thing, and this is what I was just gonna say, is I think there is a certain amount of like input into it, and I think a big question is who's gonna do that work.
Right.
Right now, a lot of that falls to the clerk's office, on top of all the other things, you guys do in that office. So I think that is the other big question. It's not just how, but who.
Right.
Yeah.
I also, I don't think we know, that beyond one person on this, council, our Nixle and our wards is really underutilized.
Uh-huh.
The only person that can brag about their Nixle usage is right here. I know I cannot, I don't know what your numbers were, Katie. but-
It's okay.
Okay.
I think I'm second, but not even close. Not even close.
Right.
Yeah.
So, there's a great resource that's underutilized. I keep thinking, could that be a Nixle type of thing?
Sure.
Whereas, especially in days when it's bad, here it will be bad, go to the website and you can see exactly
Yeah.
time or whatever it might be.
I think the thing with Nixle is we initiate them, so it's not necessarily when the person is curious.
Right.
Like if
That's
I'm
the point.
curious about whether the pool is open, I want to be able to go somewhere and find out that information in real time. So I think just to underscore maybe the point that you were trying to get at is whether or not we get these sensors, I think we have to prioritize getting the information out in a way that's accessible. One thing that has worked for me, and this kind of goes back to what you were saying, Mark, of like, how do we keep this going after we're no longer the people doing it, is I have a group in addition to my page, because I agree with you on Facebook, like, whether or not people see things is up to the algorithm gods. But in the group, and so I have to like approve people who join, and they have to tell me where they live, so I get kind of that connection. But then I can tag, like if it's something that's really important, I can tag everyone. So if they go on Facebook, they'll have a notification from me that there's activity in the group. So if there's something that's like important, that's what I'll do. And that works pretty well to get people to see it, and it
Right.
tells you like seen by 45 or whatever. So
Okay.
that for me, that's been working pretty well. But again, like I'm one of 8, and who knows if that will continue, when it's not me anymore.
Right.
So yeah, there are a lot of different ways, and it's tricky because what works for my constituents might not work for your constituents. So even trying to set council members up with, here's what you should do, it's like, maybe.
Right. Well, and the bottom line is, I guess, to your point, is that regardless of getting information out to people, we need to have, and I think to your point originally, we need to have this information available to them so that if they want to see it, if they want to understand it, it's there. I think that is that kind of level of transparency that we owe to our to the members of this community. We give them that. So then it's up to them. We can try to get the word out where to access this, but then it's up to them. All right. Well, it sounds like then we're on the right track in terms of Greg and Chris doing further research into this and bringing back information. Any other concerns about that at all?
No, I think that's cool, especially, and I know it's more expensive, but if it's integrated into other systems, we might avoid what Chief Knapp was saying, where it becomes not obsolete, but something we haven't used in a while, and then it's on the chopping block if it has multi-functions.
Yeah. Well, I think they were, again, the conversation got very quickly beyond my understanding of technology, to be quite honest. So we'll see what they have to say there. So to add on to the other business that I've neglected, let's dive into the wellness goals in terms of that. So thoughts about how we might, I think this is an interesting idea, and I like the idea. So how might we begin to establish these wellness goals, especially as we get into this next budget cycle, which is coming very quickly.
Our first session's tomorrow.
What's up?
I think our first discussion of this tomorrow starts tomorrow.
That's right.
It is.
Mm-hmm.
What time? Did I miss that? I have to catch up my emails.
Oh,
It's
it's at
council.
It's at council.
It's at council.
Council,
Here.
sorry. It's our first
But-
official discussion.
All right. You thought I was missing a special
No,
6
I'm
o'clock
sorry.
meeting or
No.
something like that. I got a little nervous.
If you missed it, I can move it too, so.
Okay.
There's a load of email that came over the weekend and I was completely off the grid, so I was still trying to catch up on things this morning, this afternoon.
Okay, so I thought a good place to start is like, what is community wellness? And the University of Minnesota, yes, defines community, they call it community well-being. Combination of social, economic, environmental, cultural, and political conditions identified by individuals in their communities as essential for them to flourish and fulfill their potential. When we look at community as a whole, we find 3 attributes that play a large role in well-being: connectedness, livability, and equity. So, just to continue, because they break those down into tangible things. Connectedness, fostered by a community's social networks that offer social support, enhance social trust, support members living harmoniously together, foster civic engagement, empower all members to participate in the community and democracy. Livability is housing, transportation, education, sorry for my texting, parks and recreation, human services, public safety, and access to culture and the arts. And equity is fairness and justice, basic needs of all are met, which is adequate access to health services, housing, food, personal security, and equal opportunity for education, employment, and meeting individual potential. That's a lot. I hope we didn't try to write that all down, but
Kind of covers it all.
it kind of covers it, right? So,
It's really broad.
yeah. So what does that look like for Oneonta? Maybe we can take those 3 bullet points of, and then think, are those the 3 that we agree with? Are there more? Connectedness, livability, and equity.
So, just trying to understand and kind of probe your thinking a little bit more about
Sure.
this. And the way I was envisioning it, and I kind of said it in that way, is that it was kind of like the group purchasing policy. It's
Mhm.
a set of guidelines that would guide city staff as they were working on things. This almost seems more broad than that, or how do you see this kind of being integrated into?
Yeah, well, I think one of the things that I had mentioned as an example, and they kind of mention it in here too, is like, what do we as a community, I need to shut my ringer off, what do we as a community, how do we define wellness? And then in that way, how do we move toward wellness with each budget cycle? So one of the things that they kind of mentioned is like parks and recreation. Do we think that, so say we're presented with a recreation program, can we think about that through the lens of, is this something we should support to move our community toward kind of the ideal wellness that we're looking for? Or we're asked to support, Pride Fest, maybe monetarily or in some other way. Is that something that moves us toward being an equitable community, and that falls under our definition of community wellness and ideal community wellness? Obviously, there are other considerations, just as there are in the green purchasing policy, but bringing that lens into decision making. I think first we have to discern where we want to go, so that we can say, does this help us get there or not? Does that make sense?
I just think those are, that first overview is so broad. I mean, you
Yeah.
could put everything in it.
Yeah.
Another way to maybe look at it would be like, okay, what does it mean to have physical well-being? So it's safety, it's environmental, it's access to care. What does it mean to have emotional, mental well-being? It's access to services, it's community. What does it mean to have spiritual well-being? You know, it's access to enriching activity. I don't know, there's different ways to look at well-being, I think.
Yeah, I kinda like that too.
Um,
Thinking about a person.
And all of them are going to be very broad, by just because well-being is such a broad concept.
Yeah.
So I guess we have to decide on exactly. But I love that, you know, looking at it through the lens of well-being. You know, let's fund this because it's going to improve the physical, emotional, and social fabric of our teens, or something like that. But
Yeah, so as you're describing this, and Doctor, the way you're talking about it as well, it almost feels like it's this mesh between guiding set of principles and a strategic plan that kind of, you know, how do we get here? You know, what is our goal? Where do we want to get here? And so there's these guiding principles that guide us to where we want to go, but ultimately we have a vision of what does it mean to have, what does community wellness mean? What does wellness mean, right? At an individual level and then on the community level. And right, I mean, connectedness, livability, equity are three that they use. You know, we could, you know, what does that mean to us, right?
Right.
What do we want? What is valuable to us? And I think we've been, this committee's been exploring some of that over the past, whatever it's been, year and a half, whatever it's been. And so it's like, you know, these are interesting conversations because it helps us focus on what is important and what's valuable, especially as you suggest when we're making budget decisions, or looking to support programs or not support programs, wherever it might be. And then just, I think sometimes there's really a lot of value in just framing the way we look at things, you know, that you know, who are we as a community? Well, if we can go out on the front foot and say, here's who we are, here's what we value. You know, the mayor has made it pretty clear that he would like to attract 1,000 people to this community over the next, I guess, actually 2.5 more years as well.
now,
So
yeah.
I don't know where we're at with that number, but certainly it's a goal I think we all want to see that we reach it. Maybe by, in some ways, putting our wellness values out there in the front. We are a community that values this, and then here's what we're doing to get there. That there's some value to that in terms of the public perception, which is always helpful, but more importantly, there's real value to the community, and there's real value to what the work of councils in terms of how they're looking at things. Is that consistent with how you're seeing this as well?
Yes.
All right, so here's the $50 million question. How do we do this? This is big, right? This is not just like we're not going to come up with this in 5 minutes, you know.
Right.
So how do we go about it? I mean, part of me was thinking when we were going through that one group, you know, equity and livability. I'm thinking we've got this housing commission, we've got the I always
Yeah.
butcher their name, that Human Rights
Commission,
Commission.
Community Relations, Human Rights,
It's long.
CCHR.
Thank you. Yeah, so we need to sort that out.
It's a
But
lot.
so we have these really, we have some of the, and then we have an environmental board, so we have some individuals representing, you know, on these different committees or commissions, or boards that have some background information. Do we want to see this, and I know this is an ad hoc committee that might come together and think about this, but that means that we're talking about a longer time. I don't know if we're trying to get this ready for this next budget cycle, but again, I'm trying to brainstorm aloud how we get a greater conversation around these things and some agreement on what's important in terms of that question that you both asked, what is wellness? You know, what kind of wellness do we value in this community, and what does wellness in our community mean, which is very different perhaps in other communities. So having some larger conversations about that I think would be important, and then framing out that kind of what that answer is, I think begins to get us closer to, and once we define it and understand it, then the question is how do we begin to think about that integrated into our budget practices, you know, our programs and policies. Maybe it even informs the mayor's thinking about committees and committee structures and things like that. Who knows? I'm just throwing things out there.
It's big.
Big.
Well, a few things that we know are important to us, at least a little, because we have commissions, that explore these topics. So we could start there. We could look at those things. I mean, we could start a list. But then we could look at those things and say, okay, I like the marketing angle of it too, because it's like we're committed to this, and this is what we're doing to move our community in that direction. And to, you know, Mark's delight, I'm sure, if you want to be a part of that, or if that appeals to you, like, come move here and help us, you know. So we could start with, you know, we have the public safety board, not public safety board, community police board, which I think is a commitment to equity. We have the Commission on Community Relations and Human Rights, which is also a commitment to equity. Environmental board, we value our natural resources and we want to protect them and celebrate them. What was the other one that you said? Oh, the Housing Commission. Yeah.
And the
And the-
arts and culture,
Yeah.
Arts Commission?
Yep.
Right, so you nailed it, I think, in terms of, we've already said a little bit what our values are. In some ways, right, these committees have been created and it somehow, in some ways reflects our values. Maybe not articulated as clearly as we like, but yeah.
Yeah. And so maybe a further down the road goal of this is like, how do we, if we are saying that these are the things that are also important to wellness, how do we bolster those committees and support them and make them more impactful and, you know, as a council? So like, again, if we value arts and culture, having our arts commission go unfunded in perpetuity, maybe we don't value arts and culture quite as much as we say we do, you know? And it's hard, I get it, you know? Parks and Rec. Our parks are a beautiful, shining jewel.
Really sorry, but I have to go now.
That's, okay, thanks for being here.
Thank you. All right, so next steps with regards to this, and that's a question, that's not a statement. What do you think?
Okay. Yeah. Well, I think we should start to think about things that aren't represented, right? So public health is one. I think we did a really, really great job. Not we, I had nothing to do with it. The people who responded during the pandemic did a really great job of working together to protect our community. How do we support public health and access to services? Do we agree that that's important? You know? So we can start to think about what the holes are, and that
But
might
it's
be
still-
helpful too.
Yeah, and I still think we need to define it, right? So that, I mean, I don't mind the definition, but do we agree with that definition, right? Is that what we want? And then you're right, then plug it in, and then what are the holes? I agree with your thinking all together there. And then what are those holes, and then how do we close those holes, and how do we think about in general this overall kind of unit of wellness
Yeah.
and how that influences?
You know what I'm thinking of is the way that the approach that Greg took during our last budget cycle, where he took every department and said, I rate us here. And then we kind of said, you know, do we agree with that or not? Do we think we should increase this? Do we think it's good where it is? Nobody wanted to decrease anything, but maybe we could take that approach, you know, and say, are we satisfied with this level? Is there something different we want to do? Do we want to prioritize this? And then that could inform the budget. Hey, we really want to prioritize, you know, health and human services.
Right.
I don't know.
Are you seeing this as an exercise we might perhaps do here in August?
Sure. That could be fun.
Can you send that link out that you found that?
Yes.
And maybe I can try to see if we can pull together something and begin to talk about that.
Okay. Sure.
So Lisa, I mean, right, well, I mean, I think what this has been the challenge all along with this committee, right? This is a pretty broad set of issues. Community wellness in general is massively broad, and we've been trying to figure out, and then the issues that we've encountered are incredibly complex. And of course, we are not people that are in this all the time, you know, so that we're trying to get our head around it, you know, Chief, you've been helpful in helping us head around a piece of it, and Chief Witzenberg as well, but there's still so much. So it feels like this is the same type of thing. How do we define this? How do we understand this? And then how do we set this up before? I think, to spend August getting our head around what is the wellness pieces, then what do we agree on as wellness, and then plug in what we have. I love that. What are the holes remaining? Let's have that conversation. And then once we kind of have that conversation is, how do we move this forward in terms of how does this guide what we think about? How do we keep this kind of front and center to our way? Almost like it's like a mission or a vision statement for the
That's
city.
exactly
Yeah.
what I was thinking.
Yeah.
It's kept going in my head, it sounds like a vision statement.
Right, exactly, right. So it's a positioning of wellness as a central part of what this community values. That is demonstrated in these particular ways with all these different commissions, boards, and committees, as well as then it's in our budget planning accordingly.
Yeah, it could even be things like, I know that a priority of Mark's has been to partner with, and I keep going back to healthcare, because I think that's something that I would rate as deteriorating, and access to health services. But I think that he has done a lot of outreach in getting connected to hospitals, in my understanding, in thinking about ways to partner with them. So even though that's not something where we're going to, it's not, we may not fund anything directly, creating that relationship is something that, if we were to say that having a partnership with our regional health facilities is important to us as a city. I think it gets to what you were trying to do, which I think is really forward-thinking, is, and maybe it's because we're not running again, how do we make sure that this doesn't just stop when we're done? If we can put something together, we codify it, that says this is what we define, and it could be editable then, by future councils, but it keeps it's on paper somewhere, that says this is how we define wellness, these are the things we're working toward. Then we can create a, policy that says, I think we need to define it and then work on a policy that is maybe a motion that says, these are things that this council supports
Yeah, and I was
as a
gonna,
next step.
I'm just gonna pull out, thought I had it here, but Oriana 2030, which was something that folks
Yeah.
worked on, you worked on back in the day.
Oh, just barely.
It was exactly that. It was a set of values, value statements with actions attached to it that had budgetary implications and things like that. And maybe it's kind of exactly what you're saying, is that there's a document that stands and say, this is where we stand. Not that this might change over the years, there might be things that come and go in terms of high priority, low priority, but that this is a statement of where we want to go. I mean, is that kind of how you're seeing as well? And that statement influences councils, committees, whatever.
Yeah. Yes, I had something else I was gonna say and I forgot what it was.
All right, well, unless you remember that.
I will once we adjourn, I'm sure.
Anything else from anybody? So I think we have an August meeting, we'll focus on this, and then we will spend September meeting planning the two follow-up summits, or whatever we're calling these meetings. And,
So I have to be completely honest, this committee kind of fell off my radar between last meeting and now. And so I'm hoping that this month, and I am saying this as an accountability statement, I would like to maybe just confer about this a little more. Maybe we can have the conversation about what our list, maybe we can share a Google Doc or something.
which part?
The list of the things that we value. For
Oh, yeah,
example,
yeah.
What we're working on in terms of a definition of community
Yeah,
wellness.
I agree, let's get the conversation going early. If you
Yeah.
could share that link with us that you found, that would
I
be
will.
great.
We'll start there, because then I think when we come back in August, we can talk about, we can go more through the process rather than talking about nailing down what we think that the things are.
Right, we can nail that down quickly and then move along
Yeah.
to the process pieces.
I remember what I was gonna say. I think for me personally, that having, because you had mentioned, and it is huge personally, as we move forward, know what we're going to focus on.
Right.
You know, one bite at a time, kind of thing.
This committee or this city?
This committee. Yeah, but I think as a vision statement for the city is helpful in that way as well.
Yeah.
Anything I think that helps us focus is
Yeah.
helpful.
Well, I think that's been part of the challenge of this committee, is that it's so broad that we've been trying to figure out where we can have the most positive impact on things, and recognizing we have very little ability in this particular space. It's quite different than say finance and HR, which is very immediately involves the needs of the city. And I think we've been trying to, in the past year and a half, understand this area and then really begin to figure out what our role within this and try to begin exercising that role. I think we're beginning to find a little bit more of that pace and that role. I think the facilitating of these conversations between these organizations has been helpful. I was amazed at how many groups in the last meeting hadn't spoken to one another, you know, through this period. So I think we're starting to find it, but it's been a tough, you know, it's a broad topic, without clear kind of objectives to guide us.
Yeah.
And then also recognizing that I think when the mayor put this together, COVID was pretty high on our priority list. And here, a year and a half later, it's obviously still in existence, but much less of a priority than others. So yeah, but I think it would be good to have that document inform this committee's work as well as inform the work of, you know, council in general, so.
Yeah, I think my goal with this is to give the committee clear objectives and then be able to apply that to council in some way. And I think that's through the budgeting process.
Right.
So thank you for coming with me in this fall.
No worries. All right, we good?
Yep.
Thanks, Chief, for
Yeah.
hanging out with us.
No problem.
All right, we'll call this adjourned. I'll have a gavel. Adjourned.
All right.